Lagos State, Nigeria. Thank you for joining us on Frontline this day. I am Victoria Ayola. And yes, February 6th is known as the International Day of Zero Tolerance for Female Genital Mutilation, and it was first established in the year 2003. Now, each year, around 4 million girls worldwide are at risk of undergoing female genital mutilation, which is also known as FGM, with most girls caught before the age of 15. There has been significant progress made in eliminating the harmful practice, but more is needed. I mean, as fast as possible, there's a need to end female genital mutilation in the country. Now, female genital mutilation is a procedure performed on a woman or girl to alter or injure her genitalia for non-medical reasons, and it most often involves the partial or total removal of her external genitalia. FGM is a violation of girls' rights and also a violation of women's fundamental human rights. This year, in a bid to eliminate FGM, the United Nations Population Fund, that is UNFPA, in conjunction with the United Nations International Children's Emergency Fund, UNICEF, and also the Inter-African Committee on Traditional Practices, IAC, they jointly launched the theme for the year 2021 as No Time for Global Inaction, Unite, Fund, and Act to End Female Genital Mutilation. If you recall, in 2020, the COVID-19 pandemic has negatively affected girls and women, resulting into a shadow pandemic disrupting the SDG target of 5.3 on the elimination of all harmful practice, including FGM. Now, UNFPA estimates additional 2 million girls projected to be at risk by the year 2030. Then how do we end FGM in our country, in Nigeria, and also globally? Now, joining the discussion today is Dorcas Famoyegu, and as well as Tamilore Omojola from Onelife Initiative for Human Development, as we'll be looking at the topic, Global Act to End FGM. You're welcome.
Thank you, ma'am.
Thank you very much.
Now, how prevalent is FGM internationally, or should we say, let's start from Nigeria. How prevalent is FGM when it comes to Nigeria?
Okay, female genital mutilation is a highly prevalent, harmful traditional practice. The current NDHS 2018 that we're using reported a prevalence of 20%. So that means 2 out of 10 women have been caught. So, and this is huge considering our total number, like our absolute number as a country. So, and although there is a decrease, because in NDHS 2013 we had 25%, so there was a 5% decrease, but we still have a long way to go. But globally, we have over 200 million women and girls that have been caught. So the issue is not just a Nigerian issue, although it is predominant in African countries. We've also seen it in Europe, Asia, especially now that people are traveling from one country to another. They travel with their culture. So they travel with this practice. So some actually bring back their girls home to cut them, while some actually export the circumcisers to where they are. So, and also out of these 200 million, about 44 million out of them are actually less than 14 and below. So that means cut is still going on the younger girls. So it's really a public health issue that needs us to actually pay attention to, because of the great harm that is causing in the health of the girl child and women in general.
Now, Tamilore, why is FGM a risk, or should we say, is it only the female gender that is at risk when it comes to FGM?
Okay, so FGM is female genital mutilation. So this states obviously that this relates to the female, the girl child. So basically, FGM is an harmful practice. So that's why it poses a lot of risk on the girl child when they are mutilated or when they are caught, because some of the consequences of FGM involves the girls contracting infections, which can include HIV, because of the non-sterilization of the objects that are used. And now we are getting to see a new trend, which is medicalization of FGM, where health practitioners, some health practitioners, not all, also mutilate children when they are giving birth to. So there are some hospitals where even the nurses are the ones who ask the parents, should we mutilate your girl child? So for mothers who are not educated on the consequences, on the harmful consequences of FGM, they will probably just yield that since it's a nurse that is asking me, then they should mutilate the child. But other consequences involves painful urination. Some of them, they grow up with large scars and keloids on their genitals, and also some of them, when they later grow up, they have a reduced sexual urge, which later affects them in their families when they are married. They have stillbirth, so the baby is even dead before it comes out. So, and this is really, really sad for them, for the children.
Now, apart from the physical effect it has on the female child, what is the psychological effect of FGM on a girl child?
Okay, FGM comes with a lot of consequences, and looking at it psychologically, there is this distrust that a child has that, oh, my mother or my parent could allow me go through a painful procedure like this just for what? So, as in, it has caused hatred between some children and their parents. So some will be like, especially those that are caught at older age, maybe like 6 and above, that they totally understand what happened. Like they notice the sharp difference in their life. They know that, okay, was a very painful process, and even afterward, because the pain is not just once. So some people, depending on the type of cut, they have recurrent pain, and some actually have extremely painful periods. So, and the psychology that oh, I'm different from another person, like especially when some women now go and check their external genitalia and see that, oh, it's different from the normal. So it kind of affects the self-esteem, and also those that it affects, that it causes sexual dysfunction. So it's actually the fact that, okay, I'm having this issue all because of one thing I do not have control about, and some will just keep quiet. We had a story of a woman that she had keloids formed down in her external genitalia, and she did not even know how to explain it. Her mother was dead. She didn't know what to do, so she kept herself. When she got married, the husband was like, what is happening? What are we going to do? So that was when they now had to go and meet like a grandmother, and the person was like, oh, it was because of the FGM that was done that she could not talk because she felt embarrassed about it. And by the time they sought medical care, and they were like, okay, it has to be operated and all, it actually led to the breakage of that home. So because the husband felt, oh, this is like the woman kept so much secret. So, and the woman on the other side was not happy because, okay, this was not something that she did by herself. So there are lots of painful memories that comes with survivors of FGM recalling the story of what actually happened. So psychologically, a whole lot of negative effects. And as we know, health is not just the physical aspect, it's also the total well-being. It contains both psychological, emotional well-being, and mental well-being. So FGM it's much more than just a singular process.
Now, looking at the process of FGM, what will you say is the social and cultural factor performing FGM? Why do people practice it?
Okay, so majorly people practice FGM because of the cultural myths which follows it. So we've heard people say FGM is supported by my religion. We've also heard people say FGM is if you don't mutilate a girl child, when she grows up, she won't be clean for her husband, or she won't be ready. We even heard people say, if you don't cut a girl child, when she wants to give birth to her own child, if the head of the child touches some part of the genitals, then the child will die. All of these are myths. We regard to them as myths. So these things are what are used to promote the practice of FGM. Basically, we've seen that FGM is a practice that is used to suppress the female gender. So it's like bound by the patriarchy in the society. So you just want to suppress the girl. You want to be in control of all that has to do with her. So those are some of the things that promotes FGM.
Now, in many countries, including Nigeria, FGM is increasingly carried out by trained healthcare practitioners. You actually mentioned it. And it is in contrast with their Hippocratic oaths, which is that they will not do harm to anybody, they will not harm anybody. To what extent will you say the practice is evolving, especially among health practitioners?
Okay, thank you for your question. Before going to that, I'd like to add to the myth surrounding FGM. Talking about the fact that she said it's a discriminatory culture because of the fact that there's what we call type 1, type 2, type 3, and type 4. So type 1 is cutting off the clitoris. So type 2 has to do with cutting off the clitoris and the labia minora, both with the labia majora or any of each. And type 3 has to do with sewing the genitalia together. Type 4 has to do with any type, other type, maybe pressing, pricking, and all those incisions, all those ones. So if it is type 3, the only passage that is given is for the person to urinate, which actually comes with so much pain. So now the belief in some culture is that it is when the husband is coming in that she should break in. So it's like a padlock. So that's why even in the US is regarded as a child abuse now, because they just toughened their law. They increased it from 5 to 10 years. So it's now regarded as a child abuse, and actually is gender discrimination. So and aside from that, in Nigeria, one of the most prominent belief is that a woman that is not circumcised, in quotes, because they feel that, okay, since the male child is circumcised, let's also circumcise the female child. But the female child is actually born perfect. Every part of the female genitalia is necessary. They have their roles. So they are not vestige organs that they don't have any usefulness, or they can just be there or not there. So they just believe that, okay, if we don't do this, the girl will be promiscuous. So that's a very common myth, and we have actually seen it through research and from what real life scenario is that FGM doesn't have anything to do with promiscuity. Promiscuity has to do with the way a person is raised, the environment, and the pathway of life the person has chosen. So we have seen people that did not, they were not caught, and they're not promiscuous. And we have also seen people that were caught, and they're actually sex workers. So there is no link actually. So it's actually a myth that people used to scare themselves, and they were like, oh, hope nothing will happen. So people tell in this myth. I can remember when we went to a community last year during International Day of Zero Tolerance to FGM, and the woman was asking us that, are you sure that if I don't cause my child, nothing will happen to them? They are just scared that, what if? Because the belief is that, oh, it's our tradition. Yes, we have good culture, we have positive culture of respect and all, but any culture that is harmful, we need to actually work on stopping it. So we've been able to reduce this culture of scarification, tribal marks and all. It has reduced. So as in, it's very rare for you to see somebody that they give birth to today with marks. So the same thing with FGM, we can do this also. So because people need to know that these myths are not real. Some will say it's for hygiene. And when you look at it, they said, okay, the baby will be playing with her genitals. Most of the time, they just leave these children without clothes on the ground. So infection comes in. So, and when they have issues like that, the solution is not to cut the child. So we always say that, okay, the medication for headache is not to cut off the head.
Yes.
So it's actually to treat the headache. So but these organs that are being cut off, they are needed in the body. So when the woman needs it when she grows up, where is she supposed to get it from? It can't be replaced. So those other myths that actually promote FGM. So I'm actually working on creating awareness for people to know. And going to medicalization, we've actually had stories, real life stories, about the fact that some medical practitioners actually believe, because one, they have their culture before they are medical practitioners. So some still place their culture, their belief, their personal belief over their oath of do no harm. So they believe that, oh, this is, and since they will say, okay, they can curb the short-term consequences. They will give the girl anesthetics and she would be fine. But what about the long-term consequences? What about the psychological consequences of this thing? It can't stop. So, and some doctors have even said that it can actually lead to a deeper cause that can lead to other complications. We've had cases of that's actually outside Nigeria, in Kenya, that a girl, I think around 15 years, died in the hospital while being caught. She was in the hospital, they could not control it, and that was the second case in just 2 years. So it's actually a growing issue, and some work have been done in sensitizing the medical practitioners. So another thing around that is that some believe that they are doing harm reduction, because if they don't cut the girls, the parents will go to a traditional circumciser that is more dangerous. But in real time, what they're supposed to do is to educate them, make them realize that, okay, this is dangerous, rather than going their way. And also some see it as a form of extra income, especially in countries that have strict laws about it. So they can actually charge so much because it is legal, so they make extra income and all. So, but in Nigeria, according to UNFPA, 13% of female genital mutilation is actually due to medicalization of FGM. So, but a lot of work have been done on this, and we have seen trends also that medical practitioners are telling people, they are educating women, especially during antenatal, that they should not cut their girl child. So that's the standard, and we have actually seen cases like this whereby they tell them not to cut any girl child that they have, that, okay, don't mutilate this girl, because the word people use out there is circumcise. So, but the actual reality is mutilating it, because you're actually destroying that organ. So they tell them, don't do this, this is this, and I believe that that is actually having a very good effect. But we know that our people, especially in this part of the world, anybody walking in and out of the hospital, even if the person is not a nurse, they just see them as a medical practitioner. So even if the person is just like a clerk or something, so immediately they give them an advice. Maybe that person still believes in this culture that don't answer them, is this what you should do? They will just like, so this information has to go through everyone. So even though we can work on passing like strict measures amongst the medical team, because, okay, they should know better, and they actually know better, and they're actually doing this, but we still have some of them that have this belief, which we hope that with this awareness creation, they would actually have a change of heart towards it.
Now, Tomilore, in the year 2018, fact sheet of the United Nations population on the prevalence of FGM in Nigeria shows that Osun State is the first with 77%, Ebonyi came second with 74%, Ekiti third with 72%, Imo State fourth with 68%, and Oyo State fifth with 66%. Now, in December 2018, 13% of women, about 1 out of every 10, who have been genitally mutilated in Nigeria was caught by medical professionals. And we hope that by 2030, according to UN, FGM would have gone into extinction. How can this be achieved?
Okay, so there are a lot of efforts that have been put in place right from when the commemoration of FGM started to eradicate FGM. It's even in our SDG goal to be able to eliminate FGM by the year 2030. So thanks to a lot of media campaigns to have gone up, thanks to stations like yours and other stations who have given us the opportunity to be able to talk about putting an end to FGM and everybody coming together to end it. So some of the ways we feel we can achieve it is by everyone talking about it. So now you have the knowledge that FGM is an harmful practice and should stop. You need to talk to someone just beside you, people at work, people in school, even just random people in your neighborhood. Just talk to them. Do you know anything about FGM? Have you heard of it before? So last year, at the end of the year, we trained young men in the community as advocates towards ending FGM. So these young men are tasked with going around their community to talk to people about FGM and why it should stop. So one of them, when they were trained, after they were trained, when he got back home, he had to go and ask his mom his wife, that was our daughter mutilated, because he wasn't around. So he just really figured out that I just really hope my daughter was not mutilated, because with all these things I've heard, I don't wish my daughter goes through them. So luckily for him, when he got home, his wife said the daughter wasn't mutilated, that his mother-in-law stopped it, because actually when they gave birth to the child, a nurse that was there actually what's the name? She asked them if they were going to mutilate their girl, but the mother-in-law was knowledgeable, so she was able to stop it. So she said he was really happy, and he came back to say it. Also, because of the intergenerational difference, we've seen that more younger women are opposed to the practice of FGM rather than older women. So hopefully by then, by 2030, we have a lot of younger women who have given birth to children and they've even opposed it. And also there are a lot of organizations working to eliminate FGM. There are engaging traditional leaders in the community, stakeholders, nurses, and training them on how to create more awareness and sensitize people in their community on ending FGM. So by the end of 2030, hopefully, we would have eliminated FGM.
Now, in the act of mutilating a girl child, if the act is truly against the law as stipulated in Section 9 of the Oyo State Violence Against Women Law of 2016, that anyone who performs FGM is liable to pay a fine of 100,000 naira or a jail term not exceeding 4 years or both. Now, how has this law been effective? Do we really have do we have evidence or a record of culprits that have been apprehended because of this act, in order to serve as a lesson for others?
Okay, thank you. Talking about law and FGM, I would actually say that the law, as we have them, but it's not really been implemented, because this issue actually has to do with close relationship with the mother, the grandmother, the mother-in-law, issues like that. So most times it doesn't get out. So even when an issue occurs like that, the family just covers it up. So because the problem will be like, okay, are you the one that will go and report your mother and you jail your mother because of this? Because they actually do it because of love. They don't know that it's actually bad. So most of the time it's difficult, except we take it upon ourselves as individuals to make sure that, okay, I'm going to ensure that, okay, this is not done. So most of the time the law is always the last resort. So after you've educated someone, you've told them don't do this, but they said, oh, once you still do it, okay, if you do this, then you are going to face the wrath of law. Then people shrink back. But talking about records, we can't categorically say that, because when Onelife Initiative sent an FOI to request for records, we could not get that. So, and that shows like, okay, some of the police officers were like, okay, is there any law against FGM? They don't even know. So if the person to make the arrest does not even have a full information, so that means we even need to sensitize both the police, the judiciary system, for them to know that, okay, there is a great effect. And this is not just a Nigeria issue. So, like, for instance, the VAP Act, Violence Against Persons Prohibition Act, has been passed since 2015. Till date, has not been implemented in all states. It's not active in all states. And this issue is not a Nigerian issue only. It's across the globe. So, for instance, now in Texas, this year was the first time a woman will be indicted for circumcising a girl child, but transporting a girl child to Qatar. So, like, this is 2021. So, like, we're like, what? Since all these years, it has FGM has been illegal since 1996 in US, and why is now we're just coming to the realization. And also in Portugal, we also have a woman that was sentenced to 3 years imprisonment for cutting a child, and they've had the law for like the past 5 years. But at least we have seen news around that, at least. But generally, it's always difficult to get people. What it does is that the people now go down. Like, the fact that the new trend now is younger ones are being caught, compared to before that they caught children, girls at 14, 15. But now, after naming, most of the time before 2 years old, so when they can actually just suppress it and nobody will really know about it. So, but we don't want that. What we want is that people actually willingly have a behavioral change to say, okay, we're not doing this. But that doesn't mean that the law is ineffective. If we all work together to make reports and make cases, if we have cases, then people will say that, okay, we're serious about this, and I'm sure that people would back off. So we have been having cases of renouncement, especially community and traditional leaders said, okay, they've renounced. At least late last year, that's December, we had so many communities in Osun State renouncing FGM. So a lot of communities in Imo State also renounced FGM. Even early this year, some community in Oyo State, Oyo West, also renounced FGM. This is very good. But our concern is, for every knife that is brought outside, are we sure there are no other knives in the house? So that means the focus should actually be on the demand side. If there's no demand, then the business has gone off, because it's actually a business for some people. So if women and men, everybody actually educated, and they know that, okay, this thing is dangerous, we shouldn't do it again, and they're not demanding for it, then no one is going to have a girl to circumcise.
Now, apart from renouncing FGM, UNICEF every year they try to organize programs to stop FGM at the international level. Now, locally, apart from renouncing, apart from saying it out, telling people, like everybody seeing you that you've actually renounced FGM, what other practical ways can be used to end FGM if it requires that all hands must be on deck?
Okay, so as I said earlier, we need to have conversations around it. That's like the first and most important thing, because some people, some women who are even mutilated, they don't even know they were mutilated, because they've not had a conversation about, okay, so what should the genital organ look like? Because in this part of the country or of the nation, we are really shy about talking about things like that. So even now, as Onelife Initiative, we have a School Connect project where we go into schools for about 4 weeks, and we have a comprehensive sexuality education module with them, and FGM is one of the topics that we discuss with them. So when we discuss FGM, we tell them the types, So we tell them the types, we tell them the consequences of FGM. So most of the time we even send them back home that go back home, check yourself. And if you see that there is a difference in what you look like and what we actually showed you should be the normal genital, then you could tell your mom. But if you don't trust telling your mom, then you can call us or get back to us and or go to the hospital, and so they can check you and see how far gone that you are. So just basically have conversations about it. So when we begin to have conversations about it, people know about it. So even when you hear that this person is about to be mutilated, you are able to speak up that no, you can't mutilate that child. Do you know what you are causing to the child and all of that? Recently, we still had calls from people. We had posters around around Oyo State about ending FGM. So because of those posters, we've had various calls of people calling to ask that, I saw your poster about FGM, what does it even mean? So we explained to them. There's almost someone who said it's from a family where they practice mutilation, and since when he has been giving birth to, he has not heard of any consequence, or he has not seen any reason why FGM should not even happen. So we have to take him step by step, explain to him of all the consequences, all what it does to the girl. So when we're done with this, he said, okay, thank you, that he will go back home and go and ask and challenge the elders in their family who actually do the practice to be sure that, okay, so why do you people actually do this in the first place?
Now, before we end this year's theme is tagged No Time for Global Inaction, Unite, Act and Fund to End FGM. Now, to what extent do you think this message will impact the lives of those carrying out this act, as well as liberate victims of this genital mutilation?
I actually think the team is suited and very suitable for a period like this where we have pandemic, whereby we need every hand to be on deck. So talking about no time for global inaction, there's no time for anybody to sit back and rest when it comes to issues around FGM. Everyone has to take action. Everyone has to do something. We have to come together. We have to unite. So we can't say, oh, this is just for the government, or this is just for the NGOs, or this is just for the health workers. Everyone actually have to come together and unite to do something to end. And when we're talking about funding generally is reducing, and that's globally when it comes to FGM. So that is why everyone, especially our government, has to take responsibility for issues like this to actually do something. And we know they are working on it, but they might actually have to earmark some budget and say, okay, this is for sexual and gender-based violence, especially this is for FGM, to actually tackle this issue. So, and also when we say act, as my colleague has rightly said, everyone has to say something. So we can actually also go online. So we almost everybody now has at least a social media platform, at least one. So talk about it, let people know, tell your friends. Then aside from telling your friends, educate people, like just start the conversation. So if everyone knows about this, then it would be easier for us to say that, okay, we're stopping this. So it's easy for us to end it in our own generation. And for instance, for our work that we have done with the younger generation, the work we've done even at the community level, at the grassroots level, whereby men are now advocating against FGM, is actually a good one, because women will respect it, like for a man to stand up and speak about issues that affect women, even though it affects men too indirectly. So they were like, okay, they want to listen. So men should not think, oh, it's a woman issue. No, it's a society issue that we actually have to arise to and actually act on. So everyone needs to do something to end FGM.
Yeah, so in addition to that, recently we engaged some women in the community on some of their experiences of FGM. We even have a video which we would like to show the audience. So it will be of essence. So at least you can see the reality. You can see that yes, this thing is real. This thing happened to this person, or this person actually witnessed the practice of FGM. That's what I wanted to add.
Wow, so the conversation should not stop here alone. It should not stop in your sitting room. Of course, it should continue in your workplace, in your environment, in your community, your society, because FGM must go into extinction by 2030. And I want to say a big thank you to Dorcas and Tamila for coming to the show this year. Now, before I leave, I would like to leave you with the message of the United Nations Secretary General Antonio Guterres, which says that together we can eliminate female genital mutilation by 2030. Doing so will have a positive ripple effect on the health, education, and of course economic development of girls and women. Until next week when I will come your way again, I am Victoria Ayola. Thank you for joining.